Hello friends, welcome back. Now we come to the last module of this course, and it is the end of life care. This is one area which gets very little attention in modern medical practice. Just look around yourselves. How many hospices are there as compared to the number of maternity homes and hospitals? Isn't there something we should be asking ourselves, that why is it that we have stopped caring about end of life care and we are just thinking about fixing and curing patients and their diseases? In this module, we shall see how homeopathy can change your perspective and give you the wherewithal, the tools, and the knowledge of how to make a departure of a person happy. Death and birth, these two are intertwined together. Birth and death are the most important events of a lifetime, and what is more important to understand is that death in general is much more peaceful unless there is an unnecessary interference. There is an adage, doing less is more. And in the case of end of life care, there is little you can do, but you should avoid doing more. As a matter of fact, social class and dying were never related to each other. About 300 years ago, it didn't matter whether you were an aristocrat or just an ordinary poor peasant. Both the people died alike. They died of the same causes, and the rate of death also in both the classes was the same. That has changed over the course of the last 3 centuries. Today, the cause and the time of death are influenced by social class, your status, and the wealth. It's not your malady or illness. It's your social class and wealth that decide how, where, and when you're going to die. And where do people die? Nowadays, more and more people are dying in hospital than in their natural homes. The wealthy die in hospitals, and the wealthier you are, the longer is your stay in the hospital before you die. The poor people die at home, and perhaps more peacefully. And where do people like to die? In the reference section of this module, you will find a paper which is a survey of people in the United Kingdom, and that reveals to us where people would actually like to die, not where they die. As a matter of fact, a lot of people are questioning, is now death a primitive concept? Are we not ready to accept that death and life are two sides of the same coin? All that we have done with modern medicine is to extend lifespans. It needs no telling that these extended lifespans don't add to the quality of the life. As a matter of fact, the correct way of looking at extended lifespans is to say that we have prolonged the dying process. Most of the people who end up in hospitals before their final time are drugged into oblivion, and they are intubated in most of the natural orifices. Or as a matter of fact, some new artificial orifices are made into the body in order to keep them alive. Keep them alive means in order to keep certain instruments ticking, which are taken to be proof of life. When it comes to dealing with death, doctors aren't really trained for that. The whole educational system of our doctors is based on the premise that they are supposed to train to diagnose and treat illnesses. There is no training about dying. As a matter of fact, some very seminal work was done by Elizabeth Kubler-Ross, a Swiss psychiatrist who settled in the United States, but quite surprisingly, very few books have come up after that. We shall be discussing this book and how we intend to use that in homeopathy, because Kubler-Ross's work does not give guidelines as to how to help the patient. It is more a study of her experience, a recollection of her experiences while dealing with many people whom she tended before they died. Today, all of us will acknowledge that most of the people who are inside hospital during their final phase are being kept alive beyond the point of benefit. Most of the treatment at that point is of very little benefit and of no comfort to the patient, and in fact, there is no quality of life left. Death, unfortunately, is considered to be a defeat of medicine or a defeat of science. Why couldn't I overcome? In fact, medicine or science is taken as if it is at war with death. We must change our perspective if we have to provide care to our patients. There comes a time when the patient is not looking for a cure. All that they are seeking and they're looking for is care and love and affection and bonding. Let's take a simple example of resuscitation. When a person is almost dead, there are techniques by which we can bring back the person's breathing or heartbeat. They include the standard CPR techniques. There's also an active compression decompression CPR, defibrillation, tracheotomy, coniotomy, puncture of the veins or the pericardium, decompression of the tension pneumothorax, and of course the list goes on. Let us look at what exactly does CPR do, especially for the elderly. The injuries from CPR result in rib or sternum fractures in 40 to 70% of the cases. Elderly patients are more prone to such injuries. They may lead to severe injuries of internal organs as well. And many a times there is no way you can find there has been an internal injury. And that undetected injury may even result in death. These facts and figures are taken from this book, Forensic Pathology Reviews, Volume 1. I think it runs into 6 volumes or more and is edited by Michael Sokos. End-of-life care actually is not about healing the body, but it is about healing the soul, healing the spirit, healing the person who lives inside the body. As a medical practitioner, if you are giving end-of-life care, it should be aimed at allowing the person to depart with dignity and grace, not being drugged into oblivion and not being intubated into every possible orifice in the body. End-of-life care means we are able to give some relief from chronic pain, from fear, restlessness. And for all this, the present modern mainstream medicine has very little to offer. But homeopathy has got a tremendous amount of remedies and techniques to help a person through this most delicate part of life. Death is a natural phenomenon and it is actually quite painless. Why make life miserable when it can be so easy and good? So dear friends, we come to the end of this introduction, and in the lessons that follow, you will be able to see how beautifully homeopathy deals with this most important part of life, which is end of life care. Thank you for your attention, and we shall meet again in the next lesson. Until then, bye bye.